This episode of The Dog Show features Dr. John Morgan. John is a partner veterinarian at Gordon Vet Hospital, an independently owned vet practice that has been operating since 1971. After developing an interest in animals at a young age, John studied veterinary science at Sydney University before eventually finding a home at Gordon Vet Hospital, where he specialises in orthopaedic conditions and arthritis. In the first of several interviews with John, he shares his story, as well as some general wellbeing tips for dog owners. Dr. John Morgan, welcome to The Dog Show today. Thank you very much for coming on.
Thanks for having me.
Yeah, I'm really excited to have a chat with you. We're going to have you on for a few different episodes to share some of your expertise about working with dogs at the Gordon Vet. So, yeah, thanks for coming on.
Thank you very much for having me. I'm looking forward to it.
Yeah, it should be a bit of fun. Do you want to just tell me a bit more about your backstory, like how you got into veterinary in the first place?
Yeah, absolutely. So I always had a strong interest in science and, always sort of the medical route or the veterinary route was something that I was always looking at. Obviously, a big love for animals from early on in the family, and actually my uncle was a veterinarian, and that was a bit of an impetus to decide to go into the field. And then I was fortunate enough, obviously, to get into Sydney Uni straight out of school. Very lucky to get the mark that I did to sneak in.
I'm sure that was a pretty premium one to get into vet at Sydney.
Yeah. It was, and it was definitely, it was the top of the list. So I couldn't have been happy to get in. And these days, what students have to do to get in, I think I was also lucky with the time that I got in as well, because it's definitely a much more challenging career to get into now.
Okay. And you did a bit of work overseas as well?
Yeah. So I had my first couple of years. I went a little bit country. So I was out in Goulburn for 2.5 years when I graduated. Tried to do a little bit of mixed animal practice. So saw a few large animals like horses, sheep and cattle. And then sort of decided it was time to spread my wings or get overseas, almost like a little gap year. And then ended up in Canada for 2.5 years.
Okay.
So my now wife and I did a bit of traveling across the country, sort of in Vancouver and Toronto, working all over the place, even up towards Alaska, which was pretty amazing.
Yeah, cool. Yeah, it's interesting. There was one thing that jumped out at me. My wife's actually from Toronto.
Oh, cool.
Yeah, and we got married over in BC in Vancouver. So
yeah, nice. Yeah,
quite familiar with Canada.
Yeah.
It's culturally similar to Australia, I find.
100%. Yeah. I mean, it was so easy to transplant over there. Really, really nervous at that age to experiment with going overseas, but the experience that I had, everyone was so warm and sort of really understood where I was coming from. And working over there, it was a really smooth transition. I think the culture was pretty much identical.
We've got Frankie, my dog, walking around and with her claws on the ground here, which is interesting.
Yeah, I think she can sense the vet in the room.
Potentially. She's doing something anxious at the moment. Yeah. We might remove her from the situation for the next one, but so what do you specialise in at Gordon Vet?
Yeah, so my main area of expertise is sort of a lot of the orthopaedic cases or arthritis cases.
Okay.
So I often get internally referred to for cases of chronic arthritis or even young dog limping can be a bit of a sign of a future issue, which is sort of where I've trained up a little bit more and I have a bit more experience in those cases. And then leading on from that, I do a few of the more complicated orthopaedic surgeries, so sort of knee repairs or even some hip repairs, if we need to do them there. But also, obviously, we have a wide range of specialist facilities in Sydney now, so it's about picking the right vet for the cases that are a little bit beyond my skill set.
Okay, yeah. So I think we'll talk about orthopaedics and arthritis a little bit more in a later episode.
Yep.
But are there any particular breeds that are more exposed to those type of conditions?
Yeah, I guess obviously we always have a red flag on the large breed dogs. So Irish Wolfhounds, obviously very large dog, very fast growth, and they often have a lot of, unfortunately, bone cancers and hip disorders. But Labradors are another very common breed that are susceptible to, again, potentially bone cancer, but also hip disease and even knee disease. Because they do have a love of food, which does sort of increase their weight, which puts them at risk of those conditions.
Yeah, so the weight management is so important.
Yeah. It's vital, and we try and pick that up from a young age and at least talk to people about how best to approach it. But yeah, it's a key element in managing these cases, which again we can talk about a bit later on.
Yeah, of course. So just as a general overview, if I'm a new dog owner and I come into Gordon Vet to see you for the first time and I've got a puppy or maybe I've got a rescue or something like that, what type of advice are you giving me to take home about well-being and looking after my dog?
Yeah, I guess it is sort of very much dependent on what's going on and the breed of the dog, but probably in our area we do talk a lot about preventatives. So obviously vaccinations and parasite prevention is probably the leading topic that we start talking about, and then from there we start to move on to diet. Obviously, what's appropriate for the breed of dog that you've got and their rates of growth, but also we do cover things like potential health issues or even preventative surgeries, which do factor in a lot of specific breeds of dogs.
Okay, so like when you say parasite prevention, you're talking about kind of the flea and tick medication and that kind of stuff.
Yeah. So flea and tick prevention is big around here, and then obviously deworming and of course heartworm prevention, which is it is creeping back into Sydney.
Yeah.
And Australia generally, we do have a bit of an issue with it, and I know that it's a big problem overseas.
Cool. So do you have any favourite breeds that you like working with, or favourite clients like me?
Yeah, obviously will, number one client. Yeah. But yeah, no, we try not to pick favourites too much. I'm actually personally looking at the moment to get an Irish Terrier.
Okay.
I quite like the terrier range types of dogs. But yeah, I like sort of the Labrador's very popular breed and a good reason for it. Really lovely nature and perfect family dog. But some of the high energy dogs, like my family grew up with beagles, so I've got a bit of a soft spot for them. Not high on everyone's list, but yeah.
I love the look of beagles. I don't know what they're like, their personalities and stuff a lot.
Yeah, high energy.
Are they? Yeah.
Would be the best way to describe it, and very much scent driven. So you find yourself chasing them all around the suburbs sometimes.
So with the Irish Terrier, presumably as a vet, that's because they've got not a lot of health conditions, or traditionally?
Yeah, traditionally. I mean, I guess when we look at a breed per se, there are a lot of conditions that unfortunately creep into breeds of dogs, just because of, I guess, the way that they were founded and the fact that they are genetically quite narrow. It's probably the nicest way to say it. We can't jump into that word. But yes, we do see the terriers in general are generally a long-lived, relatively healthy breed of dog, with the exception that unfortunately they are prone to a lot of liver or pancreatic issues. Okay. Probably one of the more common problems we see within terriers, such as Schnauzers, Irish Terriers, and dogs like West Highland White Terriers.
Okay, but I guess as you said, every breed or every dog's just like a human's going to have something in its genetic line, which could be
exactly. And I mean, I guess the even the beloved cavoodle, so the Cavalier cross poodle, we initially sort of thought, great, hybrid dog. So the benefit there is obviously we've got genetics from two different breeds that are coming together, reduces our risk of genetic problems. But we have unfortunately been finding that there is seemingly a lot of genetic conditions creeping into the breed now, such as heart murmurs and even hip dysplasia or hip disease. Right. So where we thought we'd have this amazing trend, unfortunately there even we're still having some breed-specific issues.
Yeah, it seems to be the thing to breed with the poodle, doesn't it?
Yeah.
Every other dog. Thinking that you can make a super dog, but yeah.
Yeah, and again, it did sound good, and I think that it's just obviously the boom has led to a large population of them, which to keep up with that, we find that we get back into our old habits and trying to genetically bottle
a narrow lineage.
Exactly. Yeah, and you've got your few favourite dogs, and then they end up sort of providing the gene pool for the whole
studs and all that kind of stuff.
Exactly. Yeah.
I guess that's where, as you said, it kind of the more popular it gets, the more it goes down that path. Right?
Exactly. And I mean, now we're seeing again an unusual phenomenon is this hybrid trend. The cavoodle trend has now led to actually full breed cavoodles. So
what's the difference?
Yeah, well, I guess so. One particular example is that they've developed these dogs called Tamarooks, which are locally, I think they've been bred in New South Wales as a new breed, and they've become registered, but they are essentially a cavoodle that or even a Labradoodle, so they've got sort of different sizes, but theoretically you can breed them together and you'll end up with the same dog. So
Right, okay. So rather than actually breeding the Cavalier and the Poodle, you're breeding cavoodles together
exactly
over and over again. Yeah.
exactly okay yeah, and that's where again we run into problems that depending on how narrow you want to make the gene pool.
Okay, cool. Well, John, thanks so much for coming on today's show. I've really enjoyed getting to know you, and everyone else I'm sure has as well. You've shared some interesting tips about general wellbeing for dogs. I look forward to the next time you're on.
Absolutely, thanks very much for having me.
Cheers.